Hello guys. Let me introduce myself. My name is Ahmet Suyunuc and I am teacher of biology chemistry. Today we will talk about biochemistry of blood and lympho-reticular system. Blood, together with tissue, lymphatic fluid, makes up the internal environment of the body and belongs to the connective tissue. The chemical composition of blood is complex. It contains various organic and inorganic compounds that perform strictly different functions. Blood function: the first, gas transport, oxygen from the lungs to the tissues, carbon dioxide from the tissues to the lungs. Transport of nutrients to all body cells, glucose, amino acids, fatty acids, vitamins, ketone bodies, trace elements. From different organs, the blood carries the end products of metabolism to the kidneys: urea, uric acid, bilirubin, creatinine. Regulatory of hormonoid. Local hormones or hormonoids are formed in the blood, which are transferred to target cells. Thermoregulation, the exchange of heat between tissue and blood. Osmotic function, maintaining the osmotic pressure in the vessels. Protective function, due to the presence of antibodies in the blood, and the phagocytic function of leukocytes. Detoxification, neutralization of toxic substance with the help of blood enzymes. Composition of the blood. Blood consists of plasma, 55%, and formed elements, erythrocytes, leukocytes, and platelets. Blood volume, man. Related density of blood is normal. Due to the presence of proteins and red blood cell, the viscosity of blood is 5 times higher than that of water. Sodium chloride and other low molecular weight compounds create an osmotic blood pressure, 7.6 atmosphere. A pressure equal to 0.03 atm is created due to the albumin proteins, and this pressure is called oncotic pressure. Changes in blood function occur when violation of erythropoiesis, anemia, porphyria, radiation sickness, leukemia, with liver damage, since the synthesis of most plasma proteins occurs in the liver. With vascular damage, the occurrence of blood clots, atherosclerosis. Biological function of blood plasma proteins: maintaining colloid osmotic pressure and therapy, maintaining a constant blood volume. Participation in coagulation processes. They maintain blood viscosity and, as a result, play an important role in hemodynamics. By participating in the buffer system, they maintain a constant blood pH. Erythrocytes, the main function in the transport of oxygen and dioxide carbon, since they contain 34% of hemoglobin. Its total contained in blood is 130 to 160 grams and lighter. Hemoglobin is a complex protein that consists of a simple globin protein and a hem prosthetic group. Regulation of hemoglobin synthesis. In the case, the leading role is played by hem. High concentration stimulate the synthesis of alpha and beta globin chains and inhibit hem synthesis. 4 globin chain painted in different colors. All diseases of hemoglobins are called hemoglobinosis. They are divided into groups: hemoglobinopathies and thalassemia. Acid-base equilibrium. Acidosis, the concentration of hydrogen ions in the blood is above normal limits, while the pH of the blood decreases. A decrease in pH below 6.H causes death. Metabolic acidosis is caused by the accumulation of organic acid in the tissues and blood. Is associated with metabolic disorders It's possible with diabetes, starvation, fever, disease of the gastrointestinal tract. Respiratory acidosis occurs as a result of a decrease in the minute volume of breathing. Alkalosis, decreased concentration of hydrogen ions. The limit of compatibility with life is pH is H. Respiratory alkalosis occurs with a sharply increased ventilation of the lungs, accompanied by a rapid release of dioxide carbon from the body. When inhaling pure oxygen, shortness of breath. Metabolic alkalosis develops with the loss of a large number of equivalents. Metabolism in erythrocytes is carried out in two ways: anaerobic glycolysis, pentose phosphate pathway of glucose oxidation. Iron exchange. The human body contains 5 to 6 grams of iron. Of them, 65 and to 70% hemoglobin, about 20% myoglobin, 10 to 15% liver, spleen, bone marrow cells, about 1% in heme-containing enzymes, catalase, peroxidase, cytochromes, and iron-containing non-heme proteins. Transferrin. Transferrin is glycoprotein. It performs a transfer function, the transfer of iron in the blood from places of storage to places of use. Synthesis in the liver. It has 2 iron binding sites. The concentration of transferrin in the blood is 0.4. In the intestine, there are specific proteins that ensure the absorption of iron to the blood, where they bind to transferrin. Ferritin is an oligomeric protein consisting of 24 protomers. It has a spherical shape with an inner diameter of 7.5 nanometers, into which iron ions enter through 6 channels and form a core. Iron in ferritin is in the form of hydroxyphosphates. Apoferrin, ferritin doesn't contain iron. Factors leading to iron deficiency. With a lack of iron, iron deficiency anemia develops. Acute and chronic blood loss. Iron malabsorption after bowel sugary pregnancy, elementary iron deficiency. Metabolic disorder of erythrocytes, hemoglobinopathies, sickle cell anemia, thalassemia, hereditary spherocytosis, megaloblastic anemia, porphyria, hepatoerythropoietic. Hemochromatosis. Idiopathics, a hereditary disease associated with impaired absorption of iron. Normally only 5% of iron supplied from outside is absorbed. With this pathology, about 30% of iron is absorbed, which leads to the deposition of iron in the tissues. Thank you guys for listening.